This upcoming Monday, May 28th, is Memorial Day. Memorial Day is a day to remember all those who served in the United States military.
Memorial Day became an official holiday in 1971 and is always celebrated on the last Monday of May. Memorial Day originated in towns and cities remembering those who died while serving in the Civil War. After World War I, however, Memorial Day became a day that commemorates all U.S. soldiers for their service. So remember this Monday to put up a United States flag, make sure that the flag is on the flagpole at half-mast until noon, and thank those who served for your freedom.
Coping with COVID with Tre Tailor. Updates on the pandemic and information to help you thrive and survive COVID-19. Brought to you by SCDHEC. Visit scdhec.gov for testing and vaccination sites. SCDHEC. Healthy people, healthy communities. In it together, SC and the South Carolina Diabetes Advisory Council presenting Wellness Wednesday every week on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Agape Counseling and Training Services. If you're having a challenge coping with COVID, visit Agape Counseling and Training Services at agapects.com. The Comet Bus System, offering free rides to get your COVID vaccine. Don't miss your shot. Visit catchthecomet.gov. Javis Financial Services, with over 20 years of experience. Computers Unique, Dutch Square Mall. Honest, professional, reliable computer sales and service. Palmetto Media Connections, connecting media and communities together. Coping with COVID from SCDHEC. In it together, SC, the South Carolina Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Services, the Comet Bus System, Javis Financial Services, Computers Unique, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.
Happy Friday. I'm Tre Tailor, and thank you so much for joining us with Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. And we're going to talk about that today on Coping with COVID. More COVID news this week, a South Carolina variant, another vaccine for kids, and it's a travel weekend. So what does all of that mean? Well, infectious disease expert Dr. Helmut Albrecht joins us to sort it all out for us. We're going to talk to Dr. A. Thank you so much for joining us once again today.
Thanks for having me again.
Absolutely. Plus, there is a need for foster families. How can you become one? Amber Peebles with DSS and foster parent Lee Patterson talk about fostering. Ladies, thank you so much for joining us, and we look forward to talking to you all, too, coming up next on Coping with COVID. But first, your COVID community updates. We told you yesterday about CVS offering trips, gift cards, and cruises for people to get vaccinated. Other companies are jumping on board with vaccine incentives also, including the Columbia Fireflies. They partnered with Prisma to offer free tickets to anyone who gets vaccinated at the game today or tomorrow. Now, Drip Coffee is also entering the vaccinated into a drawing for free coffee for 6 months. And you can show your vaccination card at Krispy Kreme to get a free donut. Now, next week, Kroger will begin their community immunity campaign. Now, that includes 5 $1 million prizes and 50 chances for a year of free groceries. Also, DHEC, the South Carolina Parks and Tourism, and the South Carolina Brewery Guild is working on Shot for a Beer. Now, that would get the vaccinated a free brewski. Meanwhile, State Representative Todd Rutherford wants South Carolina to offer $1 million in prizes to get vaccinated. Now, that's similar to what's being done in Ohio. He says it can help get the state out of the bottom 10 in vaccination rates. Senators considered some incentives during last month's budget debate, including offering vaccinated people $100 and a $250 college scholarship. That was voted down. And if you're expecting a baby soon, like in tomorrow, listen up. Any child born on May 29th is eligible for a $529 grant from the Future Scholar Palmetto Baby Program. You've got until August 31st to apply. Visit futurescholar.com for more information. SCDHEC has your most up-to-date list of times, dates, and location for COVID testing, vaccinations. For the most up-to-date list, visit scdhec.gov for locations, times, and dates for daily testings and vaccination sites in South Carolina, including over 130 mobile sites. Now, I'm just going to mention a couple, and throughout the show, you will see scrolling at the bottom of the screen all of the vaccination sites in the state of South Carolina. Lexington Medical Center is offering their vaccination sites. As a matter of fact, all of their locations are now walk-in, and that includes the one at Brooklyn Baptist Church. The Columbia Place Mall Vaccination Clinic is open now through June 9th, and they are now offering the J&J one-shot vaccination. The VA is offering COVID vaccinations for all people that are members or former members of the military, and also Kroger and CVS are also vaccination locations. Now, that includes the CVS that are located inside Target stores. If you or someone you know needs some help with making an appointment for their vaccination, Get Set Up is offering free assistance for seniors. Now, the Comet is not only offering free rides to get your vaccine, they are also offering vaccinations at the Comet bus station on the corner of Sumter and Laurel Street. You can stop by there and see the information on the screen. Now, if you lost someone to COVID, FEMA is giving COVID funeral expenses. You can get your reimbursement from FEMA. Check the screen for more information on that. If you or someone you know is having some financial problems due to COVID, there are several housing and bill assistance programs, including the one with Richland County. You can see that information on the screen. Also, SC Housing is offering rental and bill assistance, and they're also offering a home buying program for frontline workers. Now, the ACA open enrollment has been extended through August, and even if you have gotten your insurance, please log back on to signupsc.org or healthcare.gov and see if you qualify for additional benefits. The South Carolina Department of Mental Health has launched SC Hopes. It's a hotline for those who need help coping with COVID. And June 1st, just a couple of days away, is the last day for you to sign up for the Seniors Farmers Market. That's courtesy of DSS. DSS is also offering pandemic aid for foster youth. If you or someone you know is a foster youth, ages 14 through 24, there are funds available. And again, check the screen for more information. The Battle of the Badges blood drive is going on at Drew Wellness and Richland County Decker Center. That's going on till 3 o'clock today. There is an extreme need for blood right now in the midst of COVID. So if you are able to donate blood, you've got a little under an hour to stop by one of those two locations to donate. A couple of more things I want to tell you about is the summer feeding program. Lexington County is offering pickup for meals each Thursday from 11 a.m. Until 12 p.m. You do not have to live in Lexington. You do not have to have your child in any of those Lexington County schools. You can sign up and see that information on the screen. And the broadband for low-income folks, there you could get free broadband for your home. Again, that flyer is on the screen. So if you need more information, I would log on anyway just to see, just when you think you're not eligible for something, you are. So log on and check out and see if you are eligible for that free broadband. I'm Tre Tailor, and you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. We are streaming live on the Tailor Made Production Facebook page. That's the home of Coping with COVID. Please go over there and hit like and follow. Not only will you be able to see Coping with COVID Wednesday, Thursday, and Friday, and every first Monday, you will also be able to get all of your COVID-related updates. We are also streaming live on Instagram. Please go over there and check us out. And we're streaming live on YouTube. Would you go over there and hit the subscribe button? We would love for you to not only watch, but participate. We always want you to hit the share button so we can get the message to the masses, and also post a comment. We'd love to hear from you. Listen, COVID, the vaccine, no more masks. Yes, COVID is still very present in the United States and in South Carolina. And today, Dr. Helmut Albrecht is back for a vaccine update. Dr. Albrecht, thank you again so much for joining us. We appreciate it.
Thanks for having me.
Absolutely. So listen, There is a COVID variant that was detected in South Carolina last week. What does that exactly mean?
The bad news is there's not one variant, there are thousands of variants. There's
Wow.
a new variant now, which inappropriately was probably called the Indian variant or the double mutant or triple mutant, whatever you want it. Variants are viruses that have mutations in it. We know about 4,000 mutations that we have names for, and these viruses have combination of these mutations. So there's probably millions of different variants out there.
So how does a virus, as in COVID, get mutated? I mean, it's one thing to have COVID and then you get a mutation. How does that happen?
Well, a virus multiplies. That's how it survives and then gets transferred to somebody else. And in these steps, with this growth and with this multiplication that it does, it makes mistakes. Humans have error testing and weed those out. They still occur and those give us cancers and other things. But for viruses, that's actually essential. That's how they adapt to their host and to the environment, which has new medications, new vaccines in it. So the mutations are one of the patterns that every virus has. And as long as there are still new infections happening, this virus will continue to mutate.
So what does that mean for South Carolina? So because someone was detected with the mutation, is that correct?
We have several
mutations
with these new variants. The variants are insofar bad because they have two of the well-known mutations that were previously found, one in what was called a Californian variant and one was in Brazilian and South African variant, but now they are both in one virus together. The problem, both of those mutations make the virus probably more infectious. And that's what the virus does. It gets better at being a virus. It transmits easier. Typically, it doesn't get more deadly because that is actually a disadvantage for the virus. If you kill the host you're in, you also die. So typically, spreading more is what the virus is aiming for, and this new variant is very good at it. It's an incredible threat to non-vaccinated people.
And, I wanted to ask that. How does that affect people who are both vaccinated and non-vaccinated?
So it has a little bit of an ability to be less responsive to the vaccine, but the vaccine is so effective that it covers this.
Does it?
It may not be a 20-fold reduction of risk, but still a very significant reduction. The risk is really in the non-vaccinated. It's at least 20% more infectious than the general strain that we used to have, and that poses a significantly larger risk to unvaccinated people who don't have this 20-fold reduction of infectivity.
So you're saying if you're vaccinated, you are protected against this variant?
Yes, it's all a percentage, right? Or a fold reduction. Vaccination doesn't mean you're 100% protected.
Right.
So there may be more people that will actually develop infection. If you're vaccinated, the likelihood that you will get something that puts you in the hospital or even worse, be deadly, is still very, very minute for this. But we may see more infections, again, that can be then transmitted much more easily to unvaccinated people.
We're getting a vaccine update from Dr. Helmut Albrecht. He's an infectious disease specialist at Prisma Health. We were just talking about the variant. So do we know where the variant was detected in South Carolina? Where in South Carolina?
So DHEC has said that they found at least 4 of these variants, but I have not heard where they are. In our surveillance and our small surveillance here in our laboratory, we haven't found one. But.
So do we need to step up our game as far as protecting ourselves? Because I do believe, Dr. H, and you let me know if you're hearing this too, people are a little bit more relaxed, especially if you're vaccinated. It's getting warmer, and we're going to talk a little bit about the fact that it's a holiday weekend, and we're tired, we're COVID fatigue, and we've been told we can take off our masks. And so does this variant, should we be more concerned?
The vaccinated people were told to take off their masks.
Yes. But here's the thing, and we talked about this the last time you were here. We don't have a big V on our heads. You know what I'm saying? So who knows who's vaccinated?
The good news is our data must be totally wrong, because yesterday I was in a store and then in a restaurant. 99% of South Carolina must be vaccinated because nobody's wearing a mask anymore. And that clearly doesn't pan out. Actually, our curve flattens out quicker and more pronounced than the US curve, which is also leveling out a little bit. So we have 33% of our population seems to be immune, or should be fully immune, having 2 weeks out from both vaccines. But only 40% have gotten their first vaccine. So there's only 7% of people that could come into. We need a lot more people getting into this. And the uptake in the younger group, in adolescents, in young adults, in 12 to 18-year-olds is, may I say, pathetic online. It's not good enough.
Well, so you heard me in the news segment talk about all of these great incentives: money, cash, prizes, trips, cruises, beer. So do you think any of that's going to help that demographic?
We wanted to actually go down to 5 points and do a shot for a shot. If you go into the bar, there's a different door out and you will get a shot. But
for a shot
wasn't taken up. But what incentive do you need for South Carolina being open again, for South Carolina being normal again, for avoiding billions and billions of dollars of treating people who could have been vaccinated and should have been vaccinated, and the incentive that you don't call our elders and our ill, including probably your own grandparents and your own parents about this. What else do you really need a beer to save grandma?
Yeah, you know what, Dr. A, I hear you, and I totally agree with you, but I think there's just such a bigger problem with, I think it's, it's just, I don't think people, believe there's still COVID, what would you call it?
Denial.
Yes. Yes, it's COVID denial. There's COVID hesitation. Vaccine hesitation. There is just people who just don't care. Or vaccine, or COVID, what is it? When young people feel like they are too strong, they're too young. It can't happen to me,
Yes.
So I think there's so many other things than, do you want South Carolina to be open? Do you want your life to be better? Do you want to see your family? Do you want to live?
Those are all very good points. And it shows one thing: there's not one reason for not to get the vaccine.
Exactly.
So our answer also needs to be a multi-pronged approach. The first approach is we got to get it into the clinics, which is now happening, because you're going to trust your physician often, or your provider. And we got to get it into areas where people that are not vaccinated, whether that's minority populations, whether that's people who don't speak English, who live in areas where they can't get to the mass vaccination site. And it's preferably they should be met by people who look like them.
Exactly.
Or who they trust. So all of that needs to happen much more, and that'll help us. We had so much infection here in South Carolina that we have some immunity from disease, which may not last quite as long. But at least for now, then the numbers are doing well. But we need a better approach to make sure this goes away. I mean, we don't want to not only get rid of deaths and hospital admissions, we want this epidemic gone and be back to normal.
Yeah, Dr. Helmut Albrecht joins us. He is an infectious disease specialist at Prisma Health. I want to ask you one more question before we go to a couple of more topics that I want to cover before you leave, Dr. A. Do we know where, what areas of South Carolina are down as far as vaccines are concerned? Or is it those rural areas? Is it minorities? Is it non-English speaking people?
Yes, the highest uptake is in the urban areas. We are a very rural state.
Yes,
that's a concern, and we need a better approach to that. So yes, that is what we're seeing.
Yeah. What about, Moderna announced last week that they are going to ask for approval for a new vaccine that they have developed for those over 12 years old. And what do you think about that? Do you think that's another good option?
Yes, that's the next step after Pfizer having the emergency use authorization. That's the same thing that Moderna has actually asked for. And then we need to not only have those vaccines, but sort of convince parents, if you like your kids, get them vaccinated.
Yeah. How are vaccinations going for that younger population who just was, able to get vaccinated?
In the 15 to 18-year-olds, it's pretty good because the kids actually see what's going on here and they want to go get back, and they see this as a good way to do this. 12 to 15-year-olds are very dependent on their parents, and the parents haven't completely bought into this.
Right.
Yet. But there's been uptake, not enough, in my opinion.
Right. And I'm thinking it's, again, I'm going to wait and see how this does. I don't want to, expose my child to that and it's still new kind of thing. Is that what you're hearing?
Yes. This is so new. I don't know.
Yeah.
But we do know something. COVID, and we have now almost 200 cases of this MISH disease, which is the very inflammatory disease in these kids. That's a near deadly illness. I mean, we've been struggling for weeks with some of these kids in the ICU.
Wow.
That's really much worse than a vaccine. And again, because one of the drivers of the epidemic is asymptomatic infection, which is so common amongst kids. So vaccinating them may prevent them getting this multi-inflammatory system disease, but it also prevents them passing it on to much more vulnerable populations. So part of the vaccination for younger people, not only 12 to 15, but young adolescent, is for the community. You're helping people who probably won't have an immune system to do it on their own when they get the vaccine. You have to help them out. Right. And that's what we're trying to make sure that this age group understands.
Please continue to post and share this information out so we can get the message to the masses. We are giving you a vaccine update, a COVID update too, with Dr. Helmut Albrecht. He's an infectious disease specialist at Prisma Health. So those under 12, do you know, Dr. A, if anyone is looking at vaccinating those kids? Because again, under 12, that's still a huge population of children that are in school, that are out and about, that want to participate in ballet and basketball and soccer and everything else.
And they're difficult to really, unless you have a very strong testing program, because they so often have asymptomatic infection. They still stay socially immobile, which they are incredibly social immobile, and so they can infect other people more easily.
Yeah.
And we know this from influenza. If you don't vaccinate the children, you're missing a big percentage of this. And it's probably even larger in COVID, again, with the asymptomatic infection. So studies are ongoing in under 12 for really all the vaccines that are in the market. And we will need to see how that goes. That have to make sure that it's safe. And that I don't doubt that it's effective. It's
Right. Well, yeah.
such a good vaccine.
As I said before, many times on this show, I'm going to say hi to Mitchell Peace Joy Jen. Thank you so much. She says good information. I have custody of a 2 and a 5-year-old, and they still wear their masks. So should they?
Absolutely. Yeah. The masks down recommendation is for the 33%, not for the 66% who are not immune yet. And in actuality, we do not count in this that we have 33% vaccinated. We only count 12 and above. We don't count those kids in yet. It will actually drop off a little if they get included in this. And that's what we've seen when we added 12 to 15 into this. So we're not where we need to be. And the 66%, I've talked to a couple of people who said it's so good to go back to Target and Walmart and shop without a mask. It's like, you're not vaccinated. That's not for you. You're still under an ordinance, actually, even if the shop doesn't require it, your county may still, or your city may still require it, and that's actually law.
Right.
Don't do that. Don't infect anybody and get into real trouble when you kill a grandma off.
Yeah. Yeah. And, again, I just go back to this. The unfortunate thing is you can't tell by looking at someone if they are vaccinated or not. And that was my thing about allowing everyone to unmask. While it was great, I believed and still do believe that was just, open season for people who are unvaccinated to unmask. Because now if I'm masked, do people think I've got, I'm not vaccinated and I have to deal with that, so I think that's an extra layer of alienation, so to speak.
Yeah, and it's a stigmatization.
Yes, it is a stigmatization
in there too, and you can avoid that by just getting the vaccine. But
I hear you. Yeah.
But the problem is not for the vaccinated people.
Right.
It's still, with all these variants out there, the protection from death and severe illness for us is very good.
Yeah.
The ante has been upped for the people who are not vaccinated, because suddenly, if I, as a vaccinated person, now get an infection, I would have probably not spread it with a mask on. Now, if I have a very low-level infection, still go out, don't know that I have it, but still spread the virus, it's probably not going to spread to you because you're vaccinated, but it'll spread to these unvaccinated. So that everybody's out now really increased the risk dramatically for the unvaccinated, not so much for severe disease for the vaccinated. They are actually still protected. But 66% of the state is lying. If they're not wearing the mask where they should be.
Yeah.
And again, it's going to backfire on them, not on the vaccinated population, in my opinion.
Before you leave, we want to talk a little bit about it. It is a big travel weekend, holiday weekend, the beginning of what some say is the, summer fun. And again, we're talking about folks unvaccinated. And, so what should we be conscientious about? Should we travel? Should we wear our masks? More people are out and about. What should we do on this beautiful Memorial Day weekend?
So even for vaccinated people, the mask recommendation is still in place if you go to healthcare facilities or anything surrounding that, and if you're traveling. So it's still up in the Comet bus, it's still up in the airport, it's still up in the airplane. Mm-hmm. So if you do any of these travel routes, you're still, even as a vaccinated person, should wear your mask. And there's certainly other ways. Is a bus really so different from a school room? Is an airport so different from a football stadium? So I think you can be without your mask as a vaccinated person because it's relatively safe. You will not get, we're pretty confident that you will not get severe disease, but in the wrong circumstances and with all the other 66% not doing what they're supposed to do, I think there's no mandate to take the mask off. If you feel uncomfortable because you can't control the situation, by all means, the mask worked, not only for COVID. We had no flu season, allergy season was much better.
Right.
All of that. Don't ditch your mask yet. There's clearly on the Memorial Day, especially if you're traveling other than in the car, you're still supposed to wear your mask.
Yeah, and I still wear mine. I still wear mine. Listen. Yeah, I hear myself. Dr. Helmut Albrecht is a medical director of the Center of Infectious Disease Research and Policy at Prisma Health and the University of South Carolina. He joins us again today. And we're so appreciative of him doing that to give us a vaccine and COVID update. Dr. A, thank you. I appreciate it. Listen, you and your beautiful wife, you guys have a great Memorial Day weekend with your mask on.
Thanks. Stay safe, and thanks for having me. Have a good Memorial Day weekend.
Thank you. I appreciate it. When we come back, if you have love for children of all ages and have room in your home and your heart, there is a need for foster parents. We'll talk about that coming up next on Coping with COVID. I'm Tre Tailor.
Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by SCDHEC. Visit scdhec.gov for an updated list of testing and vaccination sites and info to help protect yourself, your family, and friends from the coronavirus. SCDHEC, healthy people, healthy communities. In it together, SC and the South Carolina Diabetes Advisory Council presenting Wellness Wednesday every Wednesday on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Visit columbiasc.net/OBO. Agape Counseling and Training Services. Call 803-779-2777 for licensed professionals of counselors and social workers helping families, engaged and married couples, and individuals of all ages gain an understanding of all aspects of their lives. If you're having a challenge coping with COVID, visit Agape Counseling and Training Services at agapects.com. The Comet Bus System, a fast, fun, friendly transit system that can take you anywhere you want to go in the Midlands. So don't miss your shot. Catch the Comet and get a free ride to get your COVID vaccine. Visit catchthecomet.gov. Javis Tax Services, South Carolina's premier full-service financial provider with over 20 years of experience. Palmetto Media Connections, connecting media and communities together. And Computers Unique, Dutch Square Mall. Call Daniel for honest, professional, reliable, and knowledgeable computer sales and service. Coping with COVID from SCDHEC. In it together, the South Carolina Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Services, the Comet Bus System, Palmetto Media Connections, Javis Financial Services, and Computers Unique.
Coping with COVID with Tre Tailor.
Need health insurance? Call Javis at 803-419-1001. Javis can get you health insurance premiums as low as $0, plus other low-cost and affordable options. 803-419-1001. Javis Tax Service. Let Javis help you file your taxes, and if you need it, get a cash advance from $500 to $6,000. Javis Tax Services, 803-419-1001. Javis Tax Service. JavisTax.com.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there, and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
Computers, they're a part of our everyday life, but when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
How will you remember the year 2020?
COVID.
Losing my job.
Working 12-hour shifts in a mask.
Losing my grandma to COVID.
COVID has claimed thousands in South Carolina and strained our health system, schools, businesses, and families. If you're struggling and need to talk, call SC Hopes. That free call can help put you in touch with people who can help. This goes for healthcare workers, teachers, restaurant employees, parents, anyone and everyone. SC Hopes, mental health and addiction support for challenging times.
You can eat what's good to you and good for you, too.
Yes.
Get the Dash for Southern Soul Cookbook free. All you have to do is ask. It's packed with delicious Southern-style recipes with a healthy twist.
Yummy.
You won't be able to taste the difference, but you will be able to feel the difference.
Yeah.
Inbox your email address to the In It Together or Tailor Made Productions Facebook page, and you'll get it straight to your mailbox. The Dash for Southern Style Cookbook and a Coping with COVID face mask. From In It Together SC, the Diabetes Advisory Council of South Carolina, and Coping with COVID.
Coping with COVID with Tre Tailor.
From the mountains
To the coast.
On the highways
and on the waterways.
No matter where you're traveling in South Carolina this holiday weekend.
We're working together to keep you safe.
Wear your seatbelt if you're on the road.
Wear your life jacket if you're on the water.
And never drink and drive.
Let's all do our part to make this a safe and enjoyable Memorial Day weekend.
Hey, good Friday afternoon. I'm Tre Tailor, and you're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. Hey, would you go over to the Tailor Made Production Facebook page and hit like and follow and share? You can get notifications to watch Coping with COVID when we come on Wednesday, Thursday, and Friday, and every first Monday with comedian George Wallace. And you can also get all of your COVID-related updates. Also on YouTube, would you hit the subscribe button? We would love for you to do that too. Hey, continue to post and share this information out so we can get the message to the masses, because we're talking about the need for foster families in South Carolina. If you have love in your heart and space in your home, consider helping a child in need. To tell us more about fostering, Amber Peoples joins us. She's statewide foster parent liaison. Thank you, Amber, so much. And foster parent Lee Patterson is also joining us today. Hey there, Lee. Thanks for joining us. Lee, I think you're on mute. We can't hear you. Okay, we're going to put Lee back. We're going to put Lee down. We're going to put Lee down, and then hopefully she can get her audio together. And also, Lee, if you will rotate your phone, we would love for you to do that. So listen, Amber, what exactly is a foster parent? We know that you can adopt, you can be a foster, you can do kinship care. What is a foster parent?
Yeah, so a foster family is someone that is licensed to provide temporary support to children and youth who are in the state's custody. And they do that until, the goal of reunification can be met and the children can return home.
All right. What are the requirements to be a foster parent?
So I'm just going to go over some basic requirements. Depending on the licensing agency that the family goes through to become licensed, there may be additional requirements, but these are kind of the basic. Someone that's interested in fostering must be able to have space in their home, like you mentioned. There has to be a bed and storage space for that child. They can share a room with another child, but so they don't have to have their own room.
Right.
But they do have to have space in that room that's theirs. The foster family must have enough income and be able to show proof of income to cover their monthly expenses. So there's no minimum financial requirement, but just as long as there's enough money coming in to cover the money going out.
Mm-hmm.
There is a pre-certification training of 14 hours that's required before you can become licensed. And like I said, depending on the agency you go through, there may be additional training that has to be completed.
Now, you say depending on the agency, so there is someplace other than DSS you can go to become a foster parent?
Yeah, so DSS recently stopped being the licensed provider for families. So you choose a private agency to go through. We did that so that we could focus on licensing kin to foster children that they're related to and may know. So we're focusing on that at DSS. And so the foster parents can go choose an agency in their area to become licensed through.
Do you have to be married?
You don't have to be married. We have foster parent families that look all different, all types of different foster parents, single, cohabitating, married. So we welcome everyone.
Yeah. Now, you talked about the training or the test. You said it's 14 hours, I think.
Yes.
Mm-hmm.
Yeah, there's no test, but you do have to complete that pre-certification training. There's a lot of information. Usually it's held over 2 Saturdays. And you also have to, have a home study done on your home. So no tests, but lots of different things that we kind of look into, background checks and things like that.
So between the time that you apply and go through the 2-week training, how long before you can become a foster parent?
So the goal is typically to try to get the family licensed within 120 days. We have families that can become licensed much sooner than that, and some that take a little bit longer. So it really depends on how motivated the family is and how quickly they're able to complete paperwork and get that all turned into their agency.
Okay, so it's paperwork in addition to the training.
Yes. Yes.
So what kind of paperwork is it? What do people need to be gathering up if they're interested in becoming a foster parent?
Sure. So we're going to have ask you for people that can provide references. Every household member has to have a medical completed by the family doctor just to make sure that everything checks out, that doesn't eliminate someone from being able to care for a child. What other paperwork? I'm trying to think.
Yeah. While you're thinking about that, how long can you be a foster parent?
So there's no minimum or maximum time. When you get your initial license, it's for 2 years. So every 2 years, you do have to go through a recertification process. There's like ongoing training and different things like that that you have to do to keep your certification up. But there's no minimum or maximum time.
Okay. Now, how many children can you foster at a time?
So the maximum number of children allowed in the home is 8, with 5 of those being foster children. So, and sometimes we do have to offer waivers for families. Like when we have a large sibling group come in, if we have a foster parent that has room and we can keep them all together, we would love to do that. So there are some exceptions to that, but generally we say no more than 5 foster children.
We're talking to Amber Peebles. She is the statewide foster parent liaison for South Carolina at the Department of Social Services. We have a foster parent, Lee Patterson, who has also joined us. We're going to bring Lee back up to see if we can hear her now. Lee, can we hear you?
Can you hear me?
Yes, Eureka. We can hear you. We can hear you. Thank you, Lee, so much for joining us. Can you tell us a little bit about your foster experience?
Sure. So we have been fostering now for about 2 years. In that time, we've had about 5 children who have come through our home, and we have been able to see 2 of them become reunificated with their families. So I was telling Amber a little bit earlier, today is the anniversary of our first child getting to go back home with his mom. And so we still maintain contact with that family and hope to get to see him soon, now that we're all vaccinated and ready to go.
Well, I have to ask, and I asked Amber this. I mean, I have custody now of my 2 and 5-year-old grandchildren, and it's been almost 2 years, and I am overwhelmingly in love with them. And I want to make sure that, again, when their parents are able to take care of them, they can. But I know it's going to be a void in my life. And so I have to ask you, not having any real family contact with those children, how challenging is it to bring a child into your home, begin to love them and care for them, only for them to leave you at some point?
I think that's probably the greatest thing that foster care has taught me is that 2 things can happen at one time. So in sending him home, I can be extremely excited that he gets to go back to his mom. And that he knows and loves. And also at the very same time, just be really sad and heartbroken over the loss that it's especially, as long as we had him and the impact that he made in our home. And I think that's just kind of experience. You're definitely, knowing and being honest with yourself. You are going to have these experiences. You're going to have these emotions, these feelings. It's going to be hard, but it's also going to be worth it. And seeing that family become whole again just kind of makes it all worthwhile.
Yeah, Lee Patterson is a foster parent. Amber Peebles joins us also. She is a statewide foster parent liaison with DSS. You make such a great point, Lee, because that's what love is about. You can love someone enough for it not to be selfish for you. You know what I'm saying? You can love someone enough to love them and be there for them when they need it, and then give them something else that they may need that may not involve you, So, you make such a great point. So, Amber, what is the need right now? I know that there's a huge need. What is that need?
So what we're really pushing right now is recruiting foster parents that are willing to work with our older children, our teens, and foster parents that are willing to take sibling groups. It is so traumatic when children come into care, and if we can eliminate some of that trauma by being able to keep siblings together, we want to be able to do that. And so we really need for, we've been encouraging our current foster parents, if you have an extra bed, increase the number of kids you can take. Maybe if you're only thinking about taking children up to 10, add a few more years to that. Maybe consider taking kids up to 12 or 13 because, our teens have to typically go into group homes when they come into care. Mm-hmm. And we really, really would love for all of our children to be able to be in a family setting whenever possible.
So when you become a foster parent, what support and resources are available? And either one of you can answer this.
Lee, you want to start?
Sure. So in addition to the trainings that Amber mentioned, trying to keep you up to date on, best practices and how to take care of these children, there's also different support groups for your county. So having access to other foster parents and who really do become friends and family, as well as respite. Foster parenting can be tough. You are taking children who have been impacted by trauma. So having an option to, get away for a weekend or a night so that you and your significant other can just have some time alone, and that child can go see a different family and make some more friends. In addition to, there's a clothing stipend. So assistance being able to help buy that child's clothing, as well as, daycare, help with paying for daycare and other expenses that you are going to have with the child. And then there's health insurance. So these children do come with health insurance, knowing that you're able to meet all their medical needs and dental needs and be able to take care of that with the state's assistance.
That's great. I'm glad that you mentioned the emotional help, because look, parenting is tough, and then when you bring, additional children in your home, you are laser focused on them. So to know that there is, a financial stipend, so to speak, food stamps, DSS. I can't remember if you mentioned food stamps because the school was calling about mine. So that's why I had to look down and see, wait a minute, what's going on? So there, you do get food stamps, you do get some kind of financial stipend. And then, as you said, the children come with health insurance. So that's good to know also. And so what do people need to do right now if they're interested in being a foster parent, Amber?
Yeah, so you can go to heartfeltcalling.org and you can submit an application online, or you can give them a call and they will help you start the process and identify a licensing agency in your area that they can send you to work with.
Right. Okay. And now I know I wanted to know the difference between foster and kinship.
Sure. So like I said earlier, we are pushing it at the agency to license kin to care for children so that they can get all of the same benefits that a foster parent does. So a kinship caregiver is someone who is either related to the child, but they don't have to necessarily be related. It can be someone that has a connection with the child, through their life outside of foster care. And then when the child comes into foster care, we can identify those folks and get them licensed so that the child can be placed there. And then a regular foster parent is just someone who is really a stranger to the child, but has become licensed because they want to care for children.
Right. Are there resources available for both?
Yes. So once you become licensed as a kinship caregiver, you're going to have the same exact benefits that a foster parent would have.
Okay. And can people contact the number on the screen that you mentioned earlier for both of those programs?
So when
you guys do?
Yeah. So DSS does the licensing for kinship. So they need to get in touch with the child's caseworker to start that process.
All right. Lee, anything else you want to add about the foster care experience?
I guess one thing I'll say is things I tell my kids is that we do hard things. And so, yes, loving children that are going to go home and championing those families can be difficult, when you know that a part of your heart is going to go with them. But you're doing just the most important work of giving that child a place to be safe, giving that family knowledge that their kids are safe while they're outside of their touch and their eyes, and helping them to become whole again. I think it's worth doing those hard things.
So Lee, how many children do you have of your own in the house?
I have one of my own, and then two that are currently placed with me.
Awesome. And ages?
6, 4, and 4.
Wow. Oh, okay. You've got babies. Yeah, we've got babies. So I'll have babies together because mine are 3 and 5, 2 and 5. Lee, thank you so much for joining us, and thank you so much for the work that you're doing. Once your two foster children are gone, are you going to have more children in your home?
Yes, we do not see any end in sight in foster care. We have enjoyed it. We've surprisingly close to the families that we've been able to care for. So
that's
it's
good.
our mission, I guess.
Wow, that's great. Lee, again, thank you so much for joining us on Coping with COVID. Thank you so much for all of this great work you're doing. I mean, it takes a lot. And I said in the opening, you've got to have room in your heart and in your home, So I appreciate that. And Amber, thank you also so much for joining us and for giving us all this information. If we can throw the information back up on the screen, if people want more information, they can go to the website that's on the screen right now and inquire about being a foster parent. As Amber said, there is a specific need right now for siblings and also for older kids. And is that age 13 and up?
Yeah, so all older kids in general. So I would say 7 and up, but specifically our teenagers.
Okay. All right. Thank you, ladies, again, so much for joining us today on Coping with COVID. Good luck to you, Lee. God bless both of you, and have a great weekend.
You too.
Thank you. Thank you so much. Mitchell Peace Joy Jen says, what's a beautiful calling to be a foster parent. You're absolutely right, Mitchell. Thank you so much for joining us. Listen, if you have a story or initiative that could help someone cope with COVID, would you please go over to the Tailor Made production page on Facebook and inbox me? We would love to feature your story or initiative. If you have a product or service that could help someone cope with COVID, please email copingwithtreitailor@gmail.com. And we would love for you to be a proud sponsor of Coping with COVID, just like our other sponsors, SCDHEC, the City of Columbia Office of Business Opportunities, In It Together SC, the Diabetes Advisory Council of South Carolina, Agape Counseling and Training Center, also Palmetto Media Connections, the Comet Bus System, Computers Unique, Dutch Square Mall, and Javis Financial Services, offering over 20 years of financial services to South Carolina. Next week, we're going to talk to Jamal Bradley with Juneteenth. The Juneteenth Festival is coming up next month. Also, Aditi Bustles, she is a candidate for City Council, and also it's Black Music Month. And I am so over the moon excited about talking to my media mentor, Deanna Williamson. She is the creator of Black Music Month, actually went to Congress and advocated for Black Music Month. She's going to join us next month and tell us about why she wanted to start Black Music Month, what she had to do with it. And we're going to talk to some Black music icons coming up next month on Coping with COVID. I'm Tre Tailor. Thank you again so much for joining us. Again, it is Memorial Day, a time that we pay tribute and honor those who suffered, bled, died for us. The saying for Memorial Day, theme for Memorial Day this year is remember and honor. And hopefully you will do that this Memorial Day weekend. As always, I leave you with a reading from Jesus Calling. And today on May 28th, Jesus says, "Let me anoint you with my presence. I am King of Kings and Lord of Lords, dwelling in inapproachable light. When you draw near to me, I respond by coming close to you. As my presence envelops you, you may feel overwhelmed by my power and glory. This is a form of worship, sensing your smallness in comparison to my greatness. Man has tended to make himself the measure of all things, but man's measure is too tiny to comprehend my majestic vastness. This is why most people do not see me at all, even though they live and move and have their being in me. Enjoy the radiant beauty of my presence. Declare my glorious being in the world." That's your Jesus Calling for today, Friday, May 28th. I'm Tre Tailor. Until the next time, I wish you peace, abundant blessings. Stay safe, stay careful, get your vaccine. Don't forget to wear your mask over your nose and under your chin. And please remember what this holiday is really about. Have a good one.
Coping with COVID with Tre Tailor. Updates on the pandemic and information to help you thrive and survive COVID-19. Brought to you by SCDHEC. Visit scdhec.gov for testing and vaccination sites. SCDHEC. Healthy people, healthy communities. In it together, SC and the South Carolina Diabetes Advisory Council presenting Wellness Wednesday every week on Coping with COVID. The City of Columbia Office of Business Opportunities, helping to meet the needs of small, minority, and women-owned businesses in the City of Columbia. Agape Counseling and Training Services. If you're having a challenge coping with COVID, visit Agape Counseling and Training Services at agapects.com. The Comet Bus System, offering free rides to get your COVID vaccine. Don't miss your shot. Visit catchthecomet.gov. Javis Financial Services, with over 20 years of experience. Computers Unique, Dutch Square Mall. Honest, professional, reliable computer sales and service. Palmetto Media Connections, connecting media and communities together. Coping with COVID from SCDHEC. In it together, SC, the South Carolina Diabetes Advisory Council, the City of Columbia Office of Business Opportunities, Agape Counseling and Training Services, the Comet Bus System, Javis Financial Services, Computers Unique, and Palmetto Media Connections.
Coping with COVID with Tre Tailor.